Thanks, everyone. So you can, and a big thank you as well to Professor Vajira, who, aside from chairing this meeting, is the chair for the Commonwealth Centre for Digital Health, who has done fantastic work in advancing this overall initiative, of which this is essentially the first hub to actually enable and help take forward aspects of the Commonwealth Centre for Digital Health. So today I just want to kind of give an overview of the context and background for the platform for Planet, Place and People, because I'm aware not everyone will know of its sort of background, and outline the kind of main progress that's been made since it was established a couple of years ago, and also to outline the future plans over the next 5 years. And as Professor Vajira has highlighted, this is a collaborative initiative that's between the Commonwealth Centre for Digital Health, but also the Interaction Council, of which I'm a strategic advisor for, and also the University of Southampton, which has very kindly it created a physical base for us to set this hub up, as well as a range of project-based opportunities for our digital fellows. So let's move on. So firstly, the vision of this initiative has been about creating a common good to secure a healthy planet for everyone, for all. And in essence, it has a big vision, and it's about trying to use digital tools and solutions to transform the way we deliver health systems. So it links very much with universal health coverage and universal health systems, but by utilizing digital solutions and medium to actually change the way that we deliver health systems, right from the community level, national level, but also globally. So an ambitious project. So firstly, in terms of the context, we're in a very changing world with multiple challenges. So this is a schema of key public health challenges till 2050, of which the environmental changes with climate change, and also the impact that also has on infectious diseases as well, and emerging diseases is very central, I think, for in many people's minds. But this then in turn influences the social and economic determinants of health, including inequalities, and then in turn that impacts on health outcomes, not just from infectious diseases, but also non-communicable diseases, which we've seen in significant impact with the pandemic. In terms of then thinking towards solutions, we need to transform the way we deliver our health systems going forward. And the digital transformation is a significant opportunity to enable us and to catalyze the way we actually deliver those services. So this is sort of a schema really just to highlight the challenges that we've got, changing challenges to global security, changing from the kind of traditional aspects like conflicts and wars, although they haven't gone away quite clearly, but with a greater emphasis on the impacts of things like pandemics and the climate and environmental stresses. So I just want to introduce the Interaction Council, which is one of the partner organisations for this initiative. Is a group of former heads of government chaired by Bertie Ahern from Ireland and President Obasanjo from Nigeria. There's about 40 of them. It's been going for 40 plus years. And its main focus has been on enhancing global security. And over the last few years, I've been advising them on how we can best enhance global health security through such initiatives as the Manifesto to Secure a Healthy Planet for All, and more recently initiatives around the pandemic emergency and how do we strengthen global health security going forward. So this is a sort of strategic partnership and able to influence and bring on board countries and policymakers and world leaders. And it in turn, with this digital partnership, it's a way of really bringing together the sort of strategic level with what we can actually deliver, how we can make a difference on the ground. So in terms of actually making a difference on the ground, one of the commitments or recommendations in the Manifesto to Secure a Healthy Planet for All, which came out in 2019 with the Interaction Council and was endorsed by the Commonwealth Centre for Digital Health, it outlines as a key recommendation a digital platform for planet, place and people. And this was in essence the seed or the embryo of this initiative, which Professor Vajira has outlined how over several years the Commonwealth Centre for Digital Health had been forming and growing in ambition and its approach with the launch the Commonwealth Heads of Government in 2018. But actually this created a tangible project or initiative to actually catalyse the future of the centre as well. And we hope that going forward that there will be further initiatives, not just this one. It was based on the architecture and the structure from this framework, which you'll see repeatedly, but essentially it's a health systems framework that I developed with partners over the last few years, originally with the World Health Organization, World Federation of Public Health Associations, and then also published with Commonwealth. And it's essentially a health systems framework. So it's a blueprint for how you strengthen health systems going forward with a very strong public health approach. It's hugely based on the Sri Lankan model, so very cost effective. But going forward, it needs further transformation, so it makes greater links with planet and place. And this was part of the origins of this initiative in terms of setting up a digital platform. So it builds on, you've heard the mandate from the Commonwealth Health Ministers meetings, as well as the Commonwealth Heads of Government meeting in terms of its origins through the Commonwealth Centre for Digital Health. And it also builds on work that I advanced with a health hub, policy hub with the Commonwealth. Oh. And in terms of the overall vision, we've highlighted it's about creating a common good. So this is about creating public goods or global goods to secure a healthy planet for all. So this is the Alpha team in 2020, just before the pandemic started. So that's why we're looking so happy. We didn't realise quite what would hit us in the coming years. And obviously we were able to meet in person in the first 2 or 3 months before everything became virtual. On the right-hand side, there's an outline of some tangible products as well that the two teams have developed over the last couple of years. So essentially the arrangement allows for the digital fellows from Sri Lanka to spend 50% of their time working on developing a common good through the digital platform, but also 50% of their time to advance individual projects and digital solutions that help build their own career portfolio and professional development as well. So in terms of the first Alpha team, a key challenge they had was creating the architecture for the actual platform for Planet, Place and People, and it was based on the original framework that I've already shared with you. And in 2020, a key challenge of them was essentially establishing the digital infrastructure, but also then mapping out digital solutions across the health system. So it's combining what the health system framework with what actual digital tools already existed that could be collated and put on this new platform. And essentially that was that took the majority of the year to undertake. And in December 2021, the actual digital platform for Planet, Place and People was launched as well with partners. 2021, 2020, sorry, I've got the year wrong on that. It's on 2020, apologies. And then for the next batch we had, who came at the beginning of 2021, we call the beta team, and you'll hear from them later today after this presentation. And we've been very busy over this last year, planning for the next 5 years, and developing a brochure which will circulate after this meeting, and also undertaking a significant review of digital solutions for global health security, and we'll hear some of the results of that as well this afternoon. And one of the initiatives that emerged from that was a proposal for a global app for pandemic security. And then lastly, we'll hear about the revamp for the website and the development of a PAN app to enhance advocacy and engagement of this initiative going forward. So firstly, just to say, in terms of obviously this last intake, the beta team arrived in the midst of the pandemic. So a big focus over this last year has been around the role of digital solutions for global health security. And you can see that's a key component of the health systems framework. And we've been particularly focusing on the red area in essence, and identifying digital tools across that system. So this is in further detail an outline really of scoping out what are the potential digital solutions for global health security, and I've illustrated here the sorts of solutions that we might find in the digital space that could contribute and already to some extent do contribute to global health security, but if they're enhanced and done in a coordinated way, the impact that they could have would be much more substantial. The areas in bold kind of reflect the main areas that were found in the review, so around data and monitoring evaluation, different communications tools, particularly a digital app, and we'll see a bit more on that, but also about some of the surveillance and early warning systems. You can see across the system, though, that there are other opportunities, and also on the climate and environmental challenges as well going forward, but also around tests and diagnostics, and some of the self-care stuff could be further developed going forward in the future. So this is an in-depth look at digital COVID apps that the Global Health Security Review undertook. And I just want to highlight this because this is also helped to develop a proposal as well for developing a generic pandemic app for the future. One of the most interesting things from my perspective about this was about how fragmented the whole approach had been across the world. So essentially, there were over 100 different apps found that different countries had created, and there's no sort of single generic app. and about 50% of countries had developed some sort of COVID app. But one of the real problems that we've all faced is none of them speak to each other, and they're not interoperable. And actually, there was a time lag in terms of the actual creation of apps as well. And ideally, what we want going forward, and we'll hear a bit more about this as a proposal, is a platform that actually has a generic framework for a mobile app for addressing pandemics. The actual infrastructure or the framework is created in readiness with a library of widgets and plugins that can be adapted to different settings and according to if there's a new pandemic, maybe a new variant or another infectious disease, it can be adapted. But at its essence, this proposal has a common database or framework that allows communication and an interoperable process in an anonymous way between the different countries. And that in itself means that we can be much more coordinated, much faster in our responses. It also enables things like travel and communications around those issues as well, whilst we can also have a very tailored approach according to country needs. So this is the essence of what we're calling the GAPS proposal, and we'll hear more about that later. And then the next area that we've been really developing over this last year is around advocacy, about updating and enhancing the original platform to make it easier to function. You'll hear more about that. And also the establishment of an app that's specific for the website as well, which we've called the PAN app. The H stands for health. These things will allow greater social media and engagement, which is part of the ambition of the Platform for Planet, Place and People as we go forward as well. So I now want to touch on the 5-year plan. So I've kept the beta team very busy this last year. So we've also done quite a lot of scoping out on the next 5 years, and we've used the same health systems framework to identify which areas to take forward over the coming years. And it's mostly developed as what are the sort of short, medium and long-term ambitions. We'll circulate the brochure, so you can read it at your leisure going forward. But in essence, the short-term priorities will still be about taking forward the global health security aspects, given that the pandemic has not gone away, and I think this is going to still be a main priority in the coming years, but also continuing to strengthen the advocacy aspects of the platform. For example, with social media, we want to convene sort of like more like not a think tank, but kind of convene forums to discuss topical issues and identify some of the future opportunities around the digital space as well. So we can have continued discussions around this, and also to have a more of a social media discussion forum going as well. And then in terms of governance, that's really about the sort of role that digital solutions can play in terms of strengthening global security. And this is an initiative that I'm advancing with a range of partners with the Interaction Council on how do we strengthen global health security going forward to ideally prevent future pandemics and make the world a safer place in terms of identifying other health threats as well as we go forward. And the digital transformation, I believe, is a really key aspect for how we can actually enable this to happen. But this partnership is contributing to this initiative as well. Okay, and then in terms of the medium and longer term plans as well going forward, so we also want to map out and identify further digital solutions across the prevention and knowledge aspects, as well as the areas around climate change and dealing with environmental emergencies, as well as identifying further digital solutions for promoting health, which will enable the recovery, for example, from COVID, and address things like non-communicable diseases, and the health and social care solutions as well, in terms of the sort of treatment services. And going forward into the future, and I think this is where I'm hoping we'll get some further hubs to help develop all of these different components. It'll be critical how we scale up our workforce and the infrastructure for digital solutions, and how we actually deliver health systems through the digital space. Okay, and then this is our last slide, really, and we're going to move on now to hear in further depth the progress over this last year on the global health security, the proposal for the global app for pandemic security, and the advocacy changes as well that have happened with the website and the PAN app. But really, I just want to give a big invitation to those attending and anyone else that might be interested in this initiative. We're still really in the first few years. The vision originally set out when I discussed this a long time ago, it feels, with Professor Vajira, when we sort of set up the Commonwealth Centre for Digital Health, when I headed up health in the Commonwealth, was to have a number of different hubs. They could be regional, they could be specialised in different areas that help take forward some of the vision of this initiative. And really, there's lots to do, and it's a big invitation to say, if you've got an interest to be part of this, do follow up, do contact me afterwards. I'd love to hear from you. And we're hoping to have more regular online forums to keep regular engagement as well going forward. But I now need to hand back to the chair, and a big thank you as well to all the fellows who've done an enormous amount of work over this last 2 years. Thank you.